Multiple endocrine neoplasia type 1, or MEN1 for short, is a disease that affects the endocrine system and its hormone-producing glands. To understand the effects of MEN1, we first need to identify the importance of the endocrine system. The endocrine system consists of several organs called glands. These glands create and release hormones throughout the body. These hormones control nearly all processes in the body, helping to coordinate the body's functions, from metabolism to growth and development, emotions, mood, sexual function, and sleep. The main organs of the endocrine system include the hypothalamus, pineal gland, pituitary gland, thyroid gland, parathyroid gland, thymus, adrenal glands, pancreas, ovaries, and testes, among others. Each of these glands are vital to the body as they release hormones that work together to control the body's metabolism, energy level, reproduction, growth and development, response to injury, stress, and mood. Without the endocrine system, we wouldn't be able to send chemical signals to each of our cells through the use of hormones. These cells would then be unable to carry out the instructions that are necessary for the overall function of our bodies. So any disease relating to the endocrine organs would have a major impact on the functioning of our bodies. So now that we've covered what the endocrine system actually does, we can now move on to what MEN1 actually is. MEN1, originally known as Wermer syndrome, is a hereditary condition associated with tumors of the endocrine glands, specifically the parathyroid gland, islet cells of the pancreas, and the pituitary gland. Non-endocrine tumors are also seen in MEN1, but they are less common. As mentioned before, MEN1 is a hereditary condition, meaning the cancer risk can be passed from generation to generation in a family. The gene associated with MEN1 is also called the MEN1 gene, which can be a little confusing. A mutation or alteration in the MEN1 gene gives a person an increased risk in developing endocrine tumors and other symptoms of MEN1. More than 90% of individuals who inherit the MEN1 mutation will develop one or more symptoms. MEN1 causes tumors to develop in the endocrine glands and other parts of the body. Although most of these tumors are non-cancerous, they can still cause the affected glands to increase in size and become overactive, producing too much hormone. In some cases, a large tumor may cause a gland to become underactive or unable to produce enough hormone. People with MEN1 may also develop tumors, which are usually non-cancerous or benign, in other endocrine glands and body tissues, including the skin. Sometimes they may develop in parts of the digestive tract, such as the duodenum and stomach, and often multiple tumors can develop at the same time, but in different tissues. About 95% of people with MEN1 develop tumors in the parathyroid glands by the age of 50. These four pea-sized glands produce parathyroid hormone, which helps maintain the right balance of calcium and phosphorus in your body. Over time, MEN1 can affect all four glands. MEN1-related tumors cause the parathyroid glands to become overactive, producing too much parathyroid hormone. This condition is called hyperparathyroidism, and it's the most common complication associated with MEN1. Excess parathyroid hormone causes calcium levels in your body to rise too high. Complications can include bone loss and kidney stones. Nearly 1 in 3 people with MEN1 develop tumors in the front part of the pituitary gland, called the anterior lobe. Like other pituitary tumors, these growths are often small in size and are always benign, meaning they are non-cancerous. In people with MEN1, the most common pituitary tumors are prolactinomas. A prolactinoma is a non-cancerous tumor of the pituitary gland that produces a hormone called prolactin. Normally, this hormone signals women's breasts to produce milk during pregnancy and breastfeeding. Women with a prolactinoma may notice milk discharge from their breasts when they are not pregnant or breastfeeding. Complications from having too much prolactin in the blood can include infertility and bone loss, like the image shown above. The second most common pituitary tumors in people with MEN1 are GH-producing tumors, or growth hormone-producing tumors. Excess growth hormone causes bones and other body tissues to grow larger in size, which can cause a condition called acromegaly. Related health problems can include arthritis, carpal tunnel syndrome, tumors of the colon or rectum, and heart disease. Although not as common, MEN1 can also cause tumors in other parts of the body. Some examples include tumors in other endocrine glands such as adrenal glands, carcinoid tumors, which are slow-growing tumors that are most often found in the stomach, thymus, and lungs, skin tumors and tumors under the skin, most commonly angiofibromas, lipomas, which are benign tumors made of fat cells, collagenomas, which are tumors involving a protein in the skin called collagen, meningiomas and ependymomas, which are tumors of the cells that line the brain and spinal cord. Complications may vary depending on the type, size, and location of the tumor. Most of these tumors are treated with surgery or by taking a medicine that suppresses growth or function of the tumor. Parathyroid tumors, which are almost always non-cancerous, can be removed if there is a significant amount of bone loss, kidney damage, or kidney stones. When treating patients with pancreatic neuroendocrine tumors, there are challenging treatment issues related to removing those tumors. In addition to its role in normal digestion, the pancreas regulates the level of blood glucose through insulin production. Removal of the pancreas may cause diabetes mellitus, a condition that can lead to significant health problems, and doctors may deem it necessary to take pancreatic enzyme supplements to promote digestion. Doctors must balance the benefits of pancreatic removal in a person with MEN1, such as the prevention of development of cancer spread against the spread of diabetes mellitus. Patients with a pancreatic neuroendocrine tumor that has spread to the liver may be treated with a drug that regulates the signaling in the pancreatic islet cell, everolimus. Other neuroendocrine tumors are typically removed by surgery, and other treatments may also be recommended. Pituitary tumors producing the hormone prolactin are most commonly managed with dopamine agonists, which are drugs that imitate the action of dopamine, which is a naturally occurring substance produced in the brain. Tumors that produce growth hormone are most commonly treated with surgery. MEN1 can't be fully cured, but regular testing can detect problems, and doctors can provide treatment for the tumors that grow as a result of MEN1, depending on the patient. Despite the advances in treatment of MEN1 tumors and associated functional syndromes, the life expectancy of patients remains shorter than normal population, with the death mean age being 55 years. The following is a case study of a MEN1 patient called Andy. He was diagnosed in 2005 and had surgery done in 2012. Andy was diagnosed with multiple endocrine neoplasia type 1 in 2005. His mother died in 1985 from cancer and had undergone a parathyroidectomy earlier in life following kidney stone episodes. After obtaining her post-mortem report, it was clear that she had had MEN1 but was never diagnosed. For several years prior to his diagnosis, he had been having abdominal symptoms, mainly diarrhea, nausea, and sickness. After doing blood work at his local hospital, doctors told him he was showing excess levels of gastrin, a hormone that stimulates the stomach to produce acid. Further scanning was done in late 2011, but this now showed tumors in the liver and local lymph nodes, and was consequently malignant. This meant that his illness had not followed the expected path that doctors thought it would take. Comparing Andy's symptoms to the standard MEN1 symptoms, we can see that there are many similarities. Andy's mother was said to have had MEN1. He developed pituitary and adrenal tumors. He had abdominal pain, which included diarrhea, nausea, and sickness. Lesions in the liver and local lymph nodes were identified. Pancreatic tumors were found, and he ended up having Whipple procedure in 2012. Comparing this to some of the standard MEN1 symptoms, we can see that there are many similarities. For example, MEN1 is a hereditary disease. Pituitary growths and hyperparathyroidism are common. Pancreatic growths and increased production in gastrin is also common. Adrenal tumors and increased production of glucagon is also common. And lastly, as a result of all of these symptoms, Whipple procedure is common in most MEN1 patients. Andy thanks his friends, family, and hospital staff for staying with him through his journey battling MEN1. And I thank you for paying attention to this video, and I hope you learned something. Thanks for watching.